How you doing, guys? Welcome to another online Gonstead Club. Today we're going to be doing single hand contacts and double Thenars on the knee chest. I'm Steven, I'm an officer in training.
I'm Megan, I'm an officer.
Okay, so today we're going to show first on the spine how to place the hands for single hand contact, and then Megan is going to show on me. I'm going to be the patient. Okay, so the big thing that we want to emphasize with how you place your contact hand is going to be the differentiation between the simple listing and the complex listing. So there's going to be a dash listing. Okay, so for a simple listing, regardless of whether you use the superior hand or the inferior hand, you're going to cross the spine. So I'm going to use a spinous contact. I'm going to tissue pull. Okay, I'm going to tissue pull, and I'm going to preload my torque, and my fingers are going to cross the spine. So this would be a superior hand, and if I'm going to use my inferior hand, it's the same thing. I'm going to preload the torque, and my fingers are going to cross the spine. Okay, so for a complex listing, so anything that has a dash, so a PLI-M or a PRI-M, you're going to stay parallel to the spine, and your fingers are not going to cross. Okay, so what that means is you're going to be, so if it's for a thoracic, you're going to stay on the transverse as close to you can to the spinous process as possible. You're going to preload your torque, but you're not going to cross the spine. So that will be the superior hand. If it's inferior hand, you're going to do the same thing, preload the torque, and stay parallel to the spine. Okay? So now we'll use a live person, and Megan will show on me.
Okay, for the doctor position, you're going to be straight on for single hand contact, and then slightly staggered for a double Thenar. And make sure you're protecting yourself, keep an athletic stance, make sure your back is straight. Okay, so I'm going to start with a single hand contact at L5. So I'm just going to go ahead and palpate that. I'm going to use a tissue pull, pulling I to S. And I'm going to come in with my pisiform. Make sure your hand is nice and relaxed. You don't want to have a bony pisiform on there. It's not going to be comfortable for your patient, and you're not going to get a good set on that. And then you're going to come in. There's different hand positions you can use for your stabilization hand. I prefer using 2 fingers over my pisi and wrapping the rest of my fingers around my wrist for my stabilization. You can also use a pisi over pisi contact, or you can just use a fist and set through there. Okay, so I have my contact on L5. I'm using an inferior hand contact, and my superior hand is going to be my stabilization. Your inferior hand is going to lift, while your superior hand is going to set. And because of the plane line of the disc of L5, you're going to be setting back towards the patient. So it's going to look like this. Lifting and setting back. For L2, I'm going to be using a superior hand contact because of the plane line of the disc, and using my inferior hand as stabilization. Okay, I'm still going to take a tissue pull using my inferior hand, coming across, and it's going to be lifting with the superior hand, and then setting with my stabilization hand. Okay, and then from T12 to about T9, you're going to be using an inferior hand contact again, taking a tissue pull, lifting, and then setting with the plane line. The site of imbrunation, from T5 to T9, you're going to be using a superior hand contact, tissue pull up, and then set. Once you get into the upper thoracics, you might get a little bit of a recoil of the patient's head, so make sure you utilize your knee chest head strap. So just have that nice and snug against the patient's head, and you can prevent some recoil going on there. Okay, so I'm going to go ahead and find T1. I'm going to use my inferior hand and just relax it against the patient. And this is comfortable for the patient. My hand's relaxed, it's not digging into them. Okay, and then once I set, you can see how the head starts to lift when I'm setting down. but because of that strap, it's not gonna fly back and cause like a whiplash for the patient. Okay? And you should be using this strap throughout the whole spine, but it's especially important for the upper thoracics and when you get into the cervicals with other contacts. Now I'm gonna show double thenar. For double thenar, it's gonna be for on the transverse and mammillary processes. But when you're in the thoracics, make sure you're not coming all the way out to a transverse process because you don't wanna affect the rib cage since there is an articulation between the ribs and the transverse process. So you're just gonna slightly come off the spinous and take your contact about here. Okay? You don't wanna be out here influencing the rib cage. You're always gonna stand on the side of opposite spinous laterality. So in this case, it would be a PLS, and I'm contacting the right transverse process. If I'm doing T3, I'm gonna come here, take a tissue pull, and then make sure you're lifting and setting. You want your contact hand to be driving through the disc plane line and setting, and your stabilization is just following the contact. Okay? And it's gonna be like that throughout the spine. Now I'm gonna show a complex listing for single hand contact. So in this case, for an L5, if I'm doing a PLI-M, I'm gonna be contacting the right mammillary process. So I'm gonna find L5 again, palpate for that mammillary process, and once I find that, I'm gonna take my tissue pull and set my contact. Notice how my hand is not crossing the spine anymore. You don't wanna affect the rotation by crossing your hand over the spine. And you're gonna set your contact and stabilization, and the motion is the same. You're lifting and setting. You're lifting and setting. And again, it's like that throughout the whole spine, making sure you don't cross the spinous process and just stay on the one side that you're adjusting.
All right, guys, so that was single hand contact and double thenar for the knee chest. But also remember, you can do any of these on a high-low as well. So this is just prone adjusting. Okay, so I'd recommend that you get a spine and study the different disc plane lines, and that way you don't sting anybody. That way you're always getting a good set and not jamming any of these facets. Remember always to set and hold. We're not doing toggle. This is a set and hold technique. And I hope you guys learn it very well.
All right, thank you.